How does a nerve get pinched? Well, there's many different ways, and the old ideology of the garden hose theory, where the hose just gets pinched off, applies in maybe like 10% of cases. You know, this where you get the pinching and then you're not getting any flow at the other end. But there's many other ways that nerves can get pinched, and that can affect your health. Hi, I'm Dr. Thom Green from Elmira Family Chiropractic, and I'll go through some different and common ways that we can have nerve pressure or pinching of the nerves in our body. So I'll just list off a few: disc herniations, narrowing of the vertebral canal, so like a spinal stenosis, or foraminal stenosis, so where the nerves exit from the spine, tight or tense muscles, or pressure from bone on the nerve, but that's a small percentage of the time. So let's start with disc herniation. So this it would be like an example of a disc herniation. You can see the disc is protruded laterally and back towards that little nerve there as it exits out of the nerve canal. And oftentimes when someone has a disc herniation, they'll get referred for an MRI. And we need to be careful in interpreting MRIs because millions of people have quote-unquote disc bulges or herniations on an MRI, which are completely asymptomatic or are not affecting the nerves in any sort of way, other than the disc has bulged a little bit. So if you have, let's say, a disc bulge at C6, but you're actually having a nerve root problem from like C4, then we have to be careful in interpreting that, not getting unnecessary surgery at where the problem isn't actually. So another common thing that we see is tight muscles. So for example, like a scalenus syndrome, where the scalene muscles, these muscles over here that are on the side of the neck, get all tight, and they'll pinch the nerves as they exit out between the muscles. So kind of like all of a sudden that nerve's coming out and it's getting pinched because those muscles are tight. And that's where things like massage therapy can be super beneficial in helping to loosen up those muscles and remove some of that tension and any scar tissue that may have built up in those muscles. Another area where we see tight muscles commonly is down in the glutes, in the butt. So like a piriformis syndrome, where the piriformis muscle that attaches from here over to your sacrum, that muscle will tighten up, and that will pinch the sciatic nerve, which runs underneath it directly, and it will tighten that, and that will cause like a sciatic type pain down the leg. So basically that's common when there's a sacral subluxation or sacral misalignment, and also common if there's weakness in the glutes or the lower limb and the piriformis muscles trying to stabilize that pelvis. Another common area we see too is in the upper neck, especially between the first and second bone. So the atlas here, the first bone, and the nerves as they exit out coming up underneath the skull, the greater occipital nerve. These nerves here can get pinched right between the skull and the upper neck, and that can cause referral pain around into the skull, at the base of the neck, even down into the neck. We can get headaches, neck pain, things like that. And so the major cause of a lot of the issues that I just mentioned has to do with poor posture. And so the main cause of poor posture in most people is they have a flat neck. So they're starting to lose that normal curve or lordosis in their neck, and the head starts to travel forward, and that puts tension on the rest of the spine, and then the rest of the spine starts to follow. For every 1 inch that your head translates forward, so every inch that your head goes forward, it increases the weight of your head on your body by 10 pounds. So if your head's 2 inches forward, you're carrying around an extra 20 pounds with you every single day. And the main cause of that is most people are spending a lot of time with their head down, whether on their phone, on their iPad, sitting on the computer, and technology's run the world these days. And so we're having a major postural crisis, and it's showing up. We look completely different than we did 50 years ago because people are hunched all the time. And we're seeing that in young kids too, getting early dowager humps, so rounding in those shoulders and that forward head posturing. So the best time to deal with these things is right away, and there's simple things that you can do at home, different postural exercises. And if you want to check back in my YouTube channel, I have lots of videos on things that you can do at home to improve that. If you have any other questions for me, please send me a message, comment below. I'm happy to answer any questions. Have a great day.